If you've been told that your child has pathological demand avoidance or PDA, or if you've been researching it because your child seems to refuse or avoid requests, I need you to watch this entire video. What you're seeing might not actually be PDA at all. It could be whole body apraxia, and understanding the difference is critical for getting your child the right support. Hi, I'm Dr. Dana Johnson, an occupational therapist with a PhD in child mental health and development and advanced training in functional and nutritional medicine. I've spent 2 decades working with children and adults with complex autism, and I'm seeing a concerning pattern. Children with complex autism and whole body apraxia being misidentified as having PDA, which means that they're not getting the interventions that they actually need. So today we're going to define PDA and whole body apraxia. Now, for those new to my channel, my mission is to educate everyone about whole body apraxia and complex autism. We're going to talk about the differences and similarities between whole body apraxia and PDA and why it can be confusing. And most importantly, we're going to talk about what you can do to support your child. So let's get to it. So let's start with defining PDA. The Child Mind Institute describes pathological demand avoidance as a pattern of behavior in which kids go to extremes to ignore or avoid anything they perceive as a demand. It is seen most often in people diagnosed with autism. Now, PDA is real, and I genuinely agree that children do experience it. But here's what concerns me the most. That last sentence, seen most often in people diagnosed with autism. It's leading to a lot of assumptions, especially when we're talking about individuals with complex autism. So now let's talk about what whole body apraxia is, because this is the piece of information that often gets missed. The definition of apraxia is a neurological disorder causing the inability to perform purposeful learned movements or tasks, even though the person understands the request, has the physical ability, and is willing to do it. Now, I go a lot more into detail about apraxia and its various forms in another video, so be sure to check that out. So let me break it down. The person understands what you're asking, has the physical strength and ability to do it, wants to do it, but the brain cannot create and execute the motor plan. So this can absolutely look like they're avoiding your requests or refusing to comply, but the root cause is neurological, not behavioral or anxiety-based, which we will learn is at the root of PDA. Now, here's something important to note. PDA is most often diagnosed in children with autism who are speaking and have less complex motor needs. So if you're a parent of a non-speaker or a child with complex autism, what you're reading about PDA in online groups or hearing from others may not actually match what your child is experiencing. So let me give you a clear comparison between these two conditions, because understanding the difference is essential. Whole body apraxia is a motor planning and coordination challenge. The core issue is difficulty planning and coordinating voluntary movements despite having the physical ability and desire to move. It's a neurological motor disorder that affects the how of movement. Now, you'll see struggles with initiating movement, gross motor skills like running, jumping, or climbing stairs. These are difficult. Things like stopping their body is hard, so they may elope frequently. There are difficulties with motor sequencing and coordinating complex movement patterns, but most importantly, to realize that the person typically wants to comply, but physically struggles to execute those movements. Now, the motor difficulties are relatively consistent across different contexts, and they usually benefit from occupational therapy, physical therapy, visual supports, and breaking the task down into smaller steps. Now, pathological demand avoidance is different. It's a behavioral and anxiety-driven profile within the autism spectrum. The core issue is overwhelming anxiety triggered by perceived demands or loss of control, which leads to avoidance behaviors. This is an anxiety response that affects the why, the motivation, and willingness to engage. You'll see refusal or avoidance of requests, even for preferred activities. There might be social manipulation, excuses, distraction tactics, and extreme emotional reactions when pressed to comply. The key difference here, though, is that the person often can do these tasks physically, but experiences intense anxiety about being directed or controlled. The demand avoidance can fluctuate based on anxiety levels, who's asking, and their perceived sense of control. They typically need anxiety management or collaborative approaches, reduced direct demands, and being given choices and autonomy. Now, here's a simple way to think about it. A child with apraxia might struggle to start to eat their lunch because their brain can't coordinate the motor sequence to grasp the spoon. A child with PDA might refuse to eat their lunch even though they're physically capable because the request triggers anxiety about being controlled. One is asking, "Can I do this?" The other is asking, "Will I do this?" Now let's talk about why this gets so confusing. First, apparent refusal to follow instructions. Now, with apraxia, they can't initiate or sequence those movements. It looks like defiance, but it's motor planning failure. And with a motor planning failure, that can increase anxiety, but it's motor-based, not anxiety-based. With PDA, they're experiencing anxiety first and then actively avoid. Second, inconsistent performance. With apraxia, motor planning fluctuates with fatigue and stress. And with PDA, ability fluctuates based on anxiety levels and perceived control. Third, increased difficulty with new tasks. Now, with apraxia, new motor sequences are harder to plan and initiate. With PDA, novel demands create more anxiety. Fourth, meltdowns when pressed. Now, with apraxia, it's most often frustration from repeated failure and lack of motor coaching. With PDA, it's panic when the demand becomes inescapable. Fifth, difficulty with multi-step activities. Now, with apraxia, they lose the motor sequence to plan, continue, or stop a movement. And with PDA, multiple demands feel overwhelming. And lastly, better performance when they direct or initiate the activities. With apraxia, self-initiated movements access different neural pathways that may be more automatic, and there's less pressure with a self-initiated task. With PDA, self-directed activities don't trigger demand anxiety. Okay, so the big question, how do we tell the difference? Well, I think the biggest thing is that for those who are non-speaking or don't have a reliable way to communicate, assume it's whole body apraxia first. Now, if your autistic child has reliable communication and speaks, it might be the more anxiety-based PDA. So here are 5 questions to ask yourself, and remember, this isn't black and white, but these questions will help you figure out the best way to get support. Okay, first, does your child seem frustrated or distressed when they can't do something? Now, this typically points towards apraxia. Next, does your child make excuses, negotiate, or try to distract you from the request? Well, this points typically towards PDA. Does the difficulty occur even when your child initiates the activity themselves? Well, this typically points towards apraxia, although that isn't always the case because whole body apraxia is consistently inconsistent. Does your child resist even highly preferred activities when asked? Well, this typically points towards PDA. Now, I want to make a very special note here. If your child does have unreliable speech and they answer yes or no, what they say may not be accurate because their speech is also unreliable. Now, ultimately, the thing to remember is that both can co-occur. So a professional evaluation is essential, but always consider whole body apraxia first, especially for non-speaking children with complex motor needs. Okay, so why does all this matter anyways? Well, it matters because I don't want individuals who are non-speaking or have difficulty reliably communicating to be misunderstood. There's already way too much of that. It also matters because the intervention for whole body apraxia and PDA are completely different. If your child has whole body apraxia and everyone is treating it like PDA with low demand approaches, focusing only on anxiety, they're not getting the motor planning and whole body support that they need. And if they truly have PDA and you're pushing intensive therapy without addressing the anxiety, then that's not going to work either. Whole body apraxia needs motor planning support, breaking down the tasks into smaller steps, and motor coaching just to start. And PDA needs anxiety management and strategies that give the child control and autonomy. They require different approaches. So misidentification means that your child isn't getting what they actually need. Now, if your question questioning PDA and your child is non-speaking or has complex motor needs, request a comprehensive motor planning assessment. Talk to a professional who specializes in complex autism and whole body apraxia. Before assuming PDA, consider whole body apraxia as a real possibility. Ask the questions and seek proper assessment. Make sure that your child is getting the interventions that match their actual needs. Getting this right can make all the difference in your child's progress and in reducing frustration for your entire family. Now, if you found this video helpful, please share it with other professionals and parents. And if you have questions or experiences with this topic, leave them in the comments. Thank you, and I will see you on the next video.